Mr. Speaker, in the past week there's been a lot of talk about hospitals in Alberta. Some are saying we should close rural hospitals. Earlier this fall, our Premier and Health Minister asked me to examine rural health care along with an outstanding group of dedicated health care professionals and advocates. And our diagnosis is quite different. Mr. Speaker, just like folks in cities, folks in rural Alberta get sick. They get hurt, they have babies, they contract infections, they get cancer, they suffer from mental illness, their organs fail, and at some point their earthly journey ends and they die. It's called being human. But, Mr. Speaker, shutting down facilities and forcing more rural Albertans to drive to big city hospitals to access basic health services is not human. It's inhumane. And no, Mr. Speaker, our hospitals aren't as full as the ones in the big cities, but isn't the point to keep people healthy and out of the hospital? Mr. Speaker, in my practice, a pen full of sick feedlot calves or a kennel full of sick dogs had me asking, what am I doing wrong? Rural Albertans have told us that their medical facilities have tremendous untapped potential and they could take the strain off urban facilities. And they're not talking about heart transplants or brain surgery. They understand that those have to be done at urban tertiary care centres. But they're talking about everyday stuff and stuff that goes beyond the everyday. They've told us about advanced orthopedic rehabilitation that takes place in a place called Daysland. They've told us about a clinic that's located in repurposed space in a hospital that has driven ER visits way down by stressing prevention. Where? In Vulcan. That's what they mean when they say live long and prosper. Mr. Speaker, ambulance workers do patients alongside the staff at a long-term care centre. They do rounds, they perform treatments, they keep their skills sharp, all happening in Galahad, population 119. Mr. Speaker, we know that rural health care faces challenges, but closing rural hospitals is not the answer. The ingenuity of rural caregivers and community leaders is.